Are you just turning 60? Or maybe you've been 60 for a while now? You want to get healthy, but you don't know where to start. Maybe you feel like your health is slipping away from you, and it seems like every day you're getting weaker and more frail. The good news is that it's never too late to take control of your health. As an experienced physical therapist with over 20 years of experience, I'm here to share my top tips for setting realistic health goals after 60 so you can finally achieve the healthy, active lifestyle you deserve. If you find this video helpful, please do me a favor and hit that like button. It really helps us spread our message far and wide. Let's jump into it. First, let's talk about how to set SMART goals. SMART goals are goals that are specific, measurable, achievable, relevant, and time-bound. They're a great way to focus your efforts and increase your chances of success. So let's see how we can apply these principles to health goals. Let's start with a goal that many of us might have, which is to lose weight. Instead of saying I want to lose weight, let's make it specific, measurable, achievable, relevant, and time-bound. Specific. Instead of losing overall weight, maybe your goal is to reduce your body fat percentage. This will help you keep your muscle mass and improve your body composition. Measurable. Determine how much body fat you want to lose. This could be 5% or 10%, depending on your starting point. To track your progress, you can use tools like calipars, bioelectrical impedance analysis, scales, or body fat percentage calculators. Achievable. Set a realistic time frame to reach your target. Safe and sustainable rate of weight loss is typically 1 to 2 pounds per week. Consider factors like your activity level, diet, and overall health when setting your timeline. Relevant. Losing weight can improve your mobility, energy levels, and reduce joint stress. By focusing on reducing body fat, you'll also lower your risk of chronic diseases such as diabetes and heart disease. Time-bound. Give yourself a specific deadline to achieve your goal. For example, you could aim to reduce your body fat percentage by 5% within 3 months. Let's move on to another common goal, increasing muscle strength. Again, let's make it SMART, specific. Identify the muscles you want to strengthen. For instance, if you struggle with mobility, you may want to focus on your lower body muscles, like your quads, hamstrings, and glutes. Measurable. Determine how much stronger you want to get. You can measure muscle strength in various ways, such as the number of repetitions you can perform or the weight you can lift. Achievable. Create a plan to gradually build muscle strength. Start with exercises that use your body weight for resistance and slowly add weights as you get stronger. Remember, it's essential to challenge yourself, but not overextend your abilities. Relevant. Improving muscle strength will enhance your functional mobility, making daily activities easier and reducing your risk of falls. It can also help maintain bone density and improve posture. Time-bound. Set a deadline for achieving your strength goals. For example, aim to increase the weight load you can lift by 2.5 pounds in each leg within 6 weeks. Now let's discuss a goal related to cardiovascular health, improving endurance. Once again, let's make it SMART, specific. Define what endurance means to you. It could be walking a certain distance without stopping or participating in a 5,000 walkathon. Measurable. Track your progress by monitoring the distance, speed, or duration of your walks. You can also measure your heart rate and blood pressure before and after exercise to gauge your cardiovascular fitness. Achievable. Create a plan to gradually improve your endurance. Start with shorter walks and gradually increase the distance, speed, or frequency. Make sure to rest and recover properly to avoid burnout or injury. Relevant. Improving endurance enhances your overall fitness level, reduces the risk of heart disease and stroke, and increases stamina for daily activities. Time-bound. Set a deadline for your endurance goals, such as walking for 30 minutes continuously, without stopping by the end of 3 months. Next, let's talk about balance control, which becomes increasingly important as we age. Let's make it SMART, specific. Describe your desired level of balance control. This could mean being able to stand up from a seated position without using your arms for support or performing a single leg stance for 10 seconds on each leg. Measurable. Measure your balance by recording the number of successful attempts or the duration you can hold a balance pose. You can also use tools like the Timed Up and Go test to objectively assess your balance. Achievable. Create a plan to improve your balance through exercises that challenge your stability and coordination. Start with exercises that involve narrow stance or uneven surfaces and progress to more advanced movements as your balance improves. Relevant. Enhancing balance control reduces the risk of falls, increases functional mobility, and promotes independence as you age. Time-bound. Set a deadline for achieving your balance goals. For example, aim to perform a single leg stance for 20 seconds on each leg within 2 months. Lastly, let's discuss flexibility, which is essential for maintaining good posture and preventing injuries. Let's make it smart. Specific. Identify the range of motion you want to achieve in your joints. For instance, you might want to be able to touch your toes or bend forward and reach your hands flat on the floor. Measurable. Measure your flexibility by recording the distance between your fingertips and the floor or the angle you can achieve in a particular joint. You can also use tools like a sit and reach test to assess your overall flexibility. Achievable. Create a plan to gradually improve your flexibility through stretching exercises. Hold stretches for a reasonable amount of time, such as 15 to 30 seconds. Progress to more challenging stretches as your flexibility increases. Relevant. Improving flexibility enhances posture, reduces muscle tightness, and prevents injuries. It also promotes relaxation and stress reduction. Time-bound. Set a deadline for your flexibility goals. For example, aim to decrease the distance between your fingertips and the floor by 5 inches within 1 month. There you have it. 5 specific, measurable, achievable, relevant, and time-bound goals that can guide you towards better health and well-being. It's crucial to start slow and gradually progress, ensuring that your body adapts and adjusts along the way. Remember, consistency is key. It's more effective to make small, sustainable changes to your lifestyle than to set unrealistic goals that you can't maintain. And it's okay to ask for professional guidance from trainers, therapists, or doctors to create a personalized plan that suits your needs and abilities. Prioritize your health and well-being, and enjoy the journey towards a better, healthier you.